providing, but I think the parameters now where we could just have that level of protection, allow them in, but just make sure that the right PPE, the testing, et cetera, which we may also want to just talk a little bit about. We've got to be careful about some of the expectations around these point of care testing devices. They're not as, we don't have enough of them yet in all our facilities.
And I think, and realistically, I mean, the federal government is sending, I don't know the exact number, but they're sending 15-minute tests to thousands of nursing homes throughout the country. Well, you know, we have 4,000 different facilities. Now, they're not all skilled nursing facilities, but long-term care. Right. So I don't know how they're going to pick that. I don't know who they're going to give it to in Florida. You know, those facilities have it. They could do the 15-minute, and then people could end up going in. If you have, you know, other areas that don't have that, like there's a lot of testing capacity. There's not great testing turnaround with some of these private labs that have really gotten backed up. When we were going into May, we were like, all right, we want to do 35,000 tests a day in Florida. Well, we had one day where we had 144,000 results returned. We've had 100,000 pretty consistently. So that's happening all over the country where more and more tests, a lot of asymptomatic people are testing. The problem with that is it just means that a turnaround time of 48 hours is now turning into 5 or 6 days. So to do a lab-based test for like a family member, you're not going to get the results back soon enough for it to really matter. So the point of care gives a good window, but there's not going to be a point of care at every, I mean, you know, we have this mobile bus, RV 45-minute test. And I thought about maybe just going and doing that for family members, you know, and come get swabbed, go get breakfast or lunch, and then come back if they're, but then I'm like, okay, well, how do I choose which facility to do? Because obviously we can't do 4,000 facilities. I mean, we would evidently do 1 or 2 a day. And so I think it's just a question of, you know, how many of these point of care are going to be there. Most of the companies, their first customer that they serve are the hospitals, which obviously you understand that. So they're doing that. Hospitals want more test strips and everything. Now we have the federal government doing stuff for the nursing homes, but it's not going to be enough for every facility, you know, throughout the state of Florida. So some may have the ability to do that, others won't, and so that's why we got to figure out, you know, what can we do with some of those other ones. And then also just in the meantime, these point of care tests aren't all on the ground. They're supposed to be coming this month, but in the meantime, those facilities as well will still will still be in the same predicament. But I do think if you do expand this caregiver, they can potentially be included in what we're already doing with some of the staff. And you know, the staff is about 200,000 tests every 2 weeks, but once the staff tests positive, they probably don't need to be screened anymore going forward. I mean, they can isolate, symptoms-based, return, but they're not going to get reinfected. You know, we have a pretty high belief in that. So maybe some of those tests would be available as well. So I think that there's ways that we can work on the testing, but it would probably, I don't know that it would be point of care, it would just be the periodic testing that we're doing for the staff, maybe include some family members into that.
I know in my husband's facility, which is Rose Castle at Deerwood, they are already looking into buying their own point of care machine. And we are willing, I mean, I hear from everybody, I'll pay for the test. I mean, the test that I take at my brother-in-law's practice, I take a test on Thursdays before I go see him. It costs $25, and I can, for the cost of the test, I will gladly, as will every other family member, I can promise you, gladly pay for their own test, pay for the machinery, whatever. Obviously, and now I'm, you know, learning this process to get a CLIA waiver so that the location can actually be providing that test. But those are steps going forward that we don't need to rely on the governor or the government to provide those for us if we as a community can furnish that for ourselves.
Yeah, I think the question is just going to be is how soon. Like, let's just assume all 4,000 of our facilities said, you know what, we'll buy it, and you know, maybe we don't have a lot of money, but we'll just charge, and all the families will pay. The problem is how many of those machines are going to be available, particularly in relatively short time frame. I mean, I think that, you know, we're looking at, I have no doubt that by March you will probably have these things. You can get them a dime a dozen, I bet. but we need them sooner. I mean, like now is the time we need them. So I think that's going to be the question, is just how soon are they able to get this? When the Abbott test came out, and then the Cepheid 45-minute test, we directed some of that to some of our hospitals, but they were all running short. They'd only get a certain number of test strips every week. They burned through those very quickly, and it's like, okay, can you produce more? I've talked to the CEO of Abbott, I've talked to the CEO of Cepheid over the months, and they're burning through as much as they can. They're producing as much as they can, but there's a lot of demand, and they're not in a position to be able to meet everywhere. Even we in Florida, we wanted to buy high throughput lab tests where I could just run 10,000 through each site. We have a lab in Jacksonville. We just do 10,000. And we probably can get that machine, but probably not for another 4 or 5 months. I mean, we were ready to pay for it. We were happy to do it. But this is what is going on all throughout the country. So, but I just think we just need to be creative. I mean, the testing is obviously important, but I do think that with PPE and some of these other things, I think if families have antibodies, if they have antibodies, man, we obviously need to be recognizing that and how powerful that can be. So there's a lot of opportunities, but I don't think, like, as you guys go and deliberate, I would just say, do not only fixate on testing.
Right.
You've got to think of other ways. Look, I'm comfortable with the PPE. Hell, hug them. I mean, come on. Like, it's not gonna. If you have PPE on and you hug and you don't sneeze or do something on them, you're gonna be fine. Okay, that'd be very low. Now, obviously, if you're there for 30 minutes doing that and then you do, well, then that's going to be a different situation. But to just go give a hug, I mean, I think that you could do that, and I think that would be very meaningful. I mean, as much as you want to see him in person, I kind of feel like stay 6 feet away is kind of still providing the reminder that this is still not normal, and you're still not there for that. So I do think the touch is important.
I would say it's hugely important. Another thing we don't want to lose sight of too, as mental health and wellness is a passion of mine, is to consider your mental health and wellness through all of this. Because as we are thinking of your husband, and you are on the front lines trying to care for him day in and day out, don't think that doesn't have a toll on you. And so I've talked to a lot of psychologists, and they have talked about, unfortunately, a tsunami as this starts to really set in people's minds, that people are going to need to seek care that they have not had the opportunity or have ever thought about doing in the past. So one of the things that we are working on, and we have not lost sight of, is how do someone perhaps like you, who have never sought care, who just needs to be able to talk to somebody, to get it off of their chest, to re-energize their batteries, to get back in there and do everything they can to help their loved ones, making sure that you know where to find it. Because there are avenues out there for help, but if they're out there and nobody knows that they exist, then what good are they? So that's another thing that we're working on.
I think, Mary, you may have even said, it's an unfathomable grief. They're still here, but you're completely cut off. And, we know that people have lost loved ones that they haven't been able to see. It's painful enough when someone you love needs to be cared for, and you don't have the ability